How has the use of electronic health information impacted the overall patient experience? Now, you can choose the positive or you can choose the negative. It's going to be up to you. So Laura, will you start us off?
Sure, and I think I'll just elaborate a bit on what I already shared. What you probably find in your role as a patient is that the personal health records that are provided to you have had limited applicability to you actually improving your own health care. And I would say that this was a failure at the national level to really require the electronic medical record systems to create a personal health record associated with each electronic medical record system. So, and then to hold providers accountable for making sure that they really push those individual personal health records out to patients. And so what we find, at least in my state, is that the Epic folks who are using Epic push their Epic personal health record. So I live in Cerner City. Cerner has their corporate headquarters in my city. So Cerner also pushes theirs. And so what happens as our poor patients is that they've got multiple personal health records. Their data is fragmented all over everywhere. They can't actually pull it together into any sort of consolidated view of their entire list of medications. And so guess what happens? And I'm sure this has happened to you. People just don't use their personal health records. How many of you have actually logged onto your personal health record in the last, year? A couple of you have. That's great. But this is really a tool as an employer that your employees should be using to really manage their own health care. But how can you manage your own health care if your medications are in 3 different locations? Or when you go in and you try to look at your lab tests, you look at your lab tests, at 3 different personal health record locations. So what we're starting to see is the federal government has recognized the error of their ways, and they're now encouraging the use of what we would call enhanced personal health records, which is where all providers come together, send their data to one trusted source for the patient, and the patient has one place that they can go to get high-quality education, to make sure that they have access to all of their information from all of their providers that they can use in order to communicate with all of their providers seamlessly, so they can contact their doctor at the primary care office and the specialty care doctor and the community mental health doctor to say, I just got these new results, you all need to have them. And they don't have to log into 3 different personal health records to do it. So it's really important for you as employers to be thinking about. We recognize that we've made a mistake with these personal health records, but we don't have to just stay in the mistake that we've made. Let's try to actually create something that is good for our employees that they'll use. And that's what we are trying. I mean, we're seeing this all across the nation where providers come together and say, let's create one personal health record for the people of New Jersey.
Great. Jim?
Thanks. Yeah, I agree. I think that I'll kind of go with the positive, being the eternal optimist. But, if you look at what this paradigm shift represents, it really is about patients that are getting more involved in their own care. And I agree 100%. The benefits of a patient portal and the failure of, I think, meaningful use kind of driving the plethora of patient portals. So everybody has, not 1, but 10 now. And I think that's almost worse in a way because it really represents more confusion than a solution. But when you look at what patients can do with devices, and I'll use Fitbit because I'm a fan. Yeah. I know I eat better and exercise more when I'm wearing, the crazy Fitbit on my wrist. And part of that reason is that it's keeping track. It's going to my computer, and I can find out really, right there on the computer how well I'm doing in terms of steps and how does today look, compared to yesterday. And that's a constant reminder. So I think the promise of technology, when it's easy to use and seamless and supports better well-being for patients, is where the health industry can evolve to a much better state than it is right now. And I think that we need to learn from those lessons commercially about how to make things as easy as possible for the patients to use, and that includes data flow from their medical records, easily available through patient portals, and transparent in that they don't have to figure out how to go to 6 different portals and aggregate their records and pull them together. So I think that that's probably the promise that I look for.
And Doug?
I guess I'll start with something Laura said earlier in her presentation about interoperability, which basically means things don't talk to each other, you want them to talk to each other. Today they don't. They don't interoperate. That's the big challenge, right, is trying to get these different disparate systems to actually talk together. That's the underlying foundation. So we can talk a lot about, getting clinical and claims information aggregated, but until we find a way to make that happen easily, it's going to be a challenge, number one. Number two, in terms of, personal health records, 10 years ago we tried to do that. Aetna, I remember, came out, you can get your PHR, it's wonderful, go online and get it. Nobody did it. There's no incentive for people to actually consume that health record. Things are started to change. As Jim was saying, in terms of IoT, Internet of Things, Bluetooth devices, and other cool stuff you can use. I use a Apple Watch myself. I used to have the Fitbit. It incents people to really take advantage of that and use that information. The challenge there is getting the people, unlike Jim and myself, who are kind of just personally incented to hopefully be active and do things. The people who aren't. Those are the challenge. Those are the people we have to figure out how to engage in that healthcare system. I'll give you one quick example. Yesterday, or 2 days ago, I made an appointment for a dermatology exam. I had not been to this physician before. I went through ZocDocs. So all electronic. I went online, found the schedule, found a doctor, saw if they took my healthcare insurance, scheduled an appointment. And then after that, that was all done electronically. I got text messages back confirming that appointment. I got another text message that said, rather than going to the office and spend a half an hour filling out HIPAA forms and everything else, just do it right here online on this app. I did it all there, and it's done. So within, a very short amount of time, I had something that would have taken probably hours before done in a matter of minutes. That's where technology is going. That's the kind of way we're going to be able to hopefully engage more people in this whole ecosystem that we have. So.
Great, thank you.